Hello, I'm Marquita Ingram. I'm the Oncology Nurse Navigator for UNC Health Wayne. I'm here to help you along this journey with good communication, coordination, and education to help with any healthcare barriers and become the bridge between all healthcare providers. During our breast cancer campaign, we are here to highlight the breast cancer journey and just to let you know that during this process, we are here for you.
My name is Jocelyn Rodriguez, and I am the lead mammography technologist. A mammogram is a detailed medical image that usually helps with the early detection of breast cancer or other abnormalities. So forget what everyone else has told you about a mammogram. This is your experience, not theirs. What you're gonna do is stand in front of the machine, and I'm going to position your breast on the paddle and then compress down. There's gonna be some uncomfortable feeling to it, but it's only gonna be for a few seconds. We do have a 3D machine here at the hospital, meaning it takes a better picture, a more detailed image so the radiologist can have more information to see what's going on in your breast. Your mammogram will last about 10 to 15 minutes, and after we will send you a letter in the mail, or you can see the results in my chart if you have the application. If you have a concerning area that the radiologist recommends more imaging, we will call you back for a diagnostic mammogram and/or limited breast ultrasound. After the additional imaging is done and the concerns are still there, you may get recommended a biopsy.
So this is where you would meet me. I'm Dr. Paul Wilman, one of the radiologists that provide radiology services, including mammography at the hospital. Okay, so if you've been asked to come back to the hospital for a biopsy, you'll usually arrive in the mornings, get checked into radiology. We'll talk to you about the procedure and let you know what we're going to do and have you sign a consent form. The procedure itself is pretty short. It entails cleaning off the skin of the breast and numbing things up. Once it's numb, we advance a needle into the breast with the help of either ultrasound or x-ray to the area of concern, take some sample tissues. Once the tissue is sampled, you'll be hearing back with results in about 2 days from your primary care doctor as to what the next steps might be.
My name is David Remington. I'm a general surgeon at UNC Health Wayne. My part of the process in treating breast cancer is to remove the tumor and help save as much of the breast as possible. Along with that, we remove or sample some of the lymph nodes to look at how the disease is spreading. The reason to sample the lymph nodes is to detect early spread of the disease. Sometimes if the tumor is too large or too advanced, we have to remove the entire breast, and that's called a mastectomy. And then we'll help you through options for reconstruction if that's your desire. So we do our best to make the entire surgical process comfortable for you, and most people are getting back to themselves very quickly within the matter of 1 to 3 weeks, depending on whether you have the breast conserving treatment versus the mastectomy. Most patients are going to end up getting what's called a lumpectomy, where we just remove the tumor and sample the lymph nodes. After that procedure is over and you're recovered, somewhere around 3 to 4 weeks, we're going to set you up with a doctor who helps you with your radiation therapy. They're going to radiate the breast and sometimes the armpit to help make sure we get rid of the cells that we can't see or remove. Along with radiation, sometimes cancer doctors will recommend some additional medicines, either hormones, hormone therapy, or chemotherapy is sometimes needed after surgery. But most of the time, it's just going to be the surgery and the radiation.
Hi, my name is Dr. Kasbari. I'm one of the oncologists in Goldsboro. I practice out of a private practice in addition to seeing patients in consultation in the hospital. If you are diagnosed with breast cancer, most likely you will meet a medical oncologist like myself. We will discuss treatment plan, surveillance, whether you need chemotherapy or not, whether you need biologics, immunotherapy, or hormonal therapy. One of the hardest discussions I have with my patients is whether they need chemotherapy. I think chemotherapy has a lot of bad reputation. We've been using it for more than 30, 40 years, and obviously how we dealt with side effects evolved over the years. A lot of our patients can work during chemotherapy. We have excellent medication we give to counteract some of the side effects. One of the advances in treating breast cancer with chemotherapy occurred around 2010 when we started utilizing some tests to tell us whether there is benefit of chemotherapy. So nowadays we run these tests to tell the patient whether they need the chemotherapy before or after surgery or never.
Now that you've seen this journey, whether you are 1 in 8 that has been diagnosed with breast cancer, whether you need chemotherapy or you do not need chemotherapy, just know that we are here for you.